Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Dr. Sundus Mehtab Shafi. In this video, I'm going to let you know briefly regarding the core clinical skills that are being assessed in the exam of MRCP PACES. And along with this, I'll give you brief information regarding the minimum criteria to ace this exam. So let's start with the minimum score that is being required to pass this exam. First of all, before entering the examination hall, as I always say, you should always be prepared and you should always perform your homework so nicely that the examiner should feel that you are performing the examinations or communication in a way that you are dealing with the patients on a daily basis. So, on the basis of this, you need to score 126 or more marks in total to pass this exam. But along with this, you also need to pass each skill individually. So for example, if somebody has scored 130 marks in total, but has not did not achieve the score of 14 in identifying physical signs, so that candidate will be declared as not as an unsuccessful candidate, as the physical sign is not um, being matched with the minimum criteria. So you need to pass each and every skill individually along with the total score. So as you can see that there are 7 core clinical skills that you need to pass individually. So you need to focus on individual skills as well as on the whole exam in general. So starting from the skill number 1, it is physical examination. As you can see that you need at least 16 marks out of 24 to pass this skill. And if we move on, we can see that in identifying physical signs, you need 14 out of 24. In clinical communication, you need 11 by 16. While in differential diagnosis and clinical judgment, the margin is slightly broader as compared to others, but in managing patient's concern and patient welfare, the margin is very narrow. So you need these things to keep in mind whenever you are entering the examination hall. Now let's talk about the examination skills, the clinical skills individually. So when we talk about the physical examination, this skill needs to demonstrate the thorough, correct, fluent, smooth, and a very sensible clinical examination that should be relevant to your command. The examiner should feel that you are not performing this examination in front of an examiner, or you are not performing this examination in an initial phase. He should feel that you are performing this examination on a regular basis, like you see people, you see patients, hundred of patients on a regular basis, and you have examined multiple patients with these signs and symptoms. So your examination should be very fluent, very relevant, and systematic. In second skill, you need to identify the physical signs. So you need to identify the important and the correct physical signs that are present in the patient. But more importantly, please do not cook up the signs which are not present. This is a most important thing because majority of the candidates identify or demonstrate the physical signs that are not present, especially in the general physical examination. Likewise, as the case of pallor or cyanosis, clubbing or or colonychia. So if the signs are not present, do not say that. But if you are confused or you are not very much sure regarding any physical sign, then do not say that this physical sign is present. But if the examiner asks you regarding the physical sign, then you can show your concern that you are not very much sure about this physical sign, that is why you didn't mention it. The third clinical skill is clinical communication. This is very important that, again, this is a session in which you will be acting very thoroughly. So it should be demonstrated in a way that you are actually performing or you are actually communicating with hundreds and thousands of patients on a very regular basis. And similarly, you are performing in the exam. So your clinical communication should be fluent, thorough, relevant. Very layman language should be used or simple language should be used. Do not use jargons, and your communication skills should be very much structured. Along with this, after this skill, you need to be assessed. You will be assessed for differential diagnosis. So you need to make a very sensible differential diagnosis. Please do not make a very long list of differential diagnosis. Just consider your case, your geographical location, and then give your differential diagnosis. So, for example, if you are giving the list of differential diagnosis, you need to confine yourself to 2 to 3 differential diagnoses. And on the top, you will say the diagnosis that you predict is the most correct one. And your next skill, which is of clinical judgment, will rely on your differential diagnosis. So if you didn't mention the exact diagnosis in the list of DDs, then you will not be able to give proper clinical judgment in the next skill. But when you are when you are being assessed for the clinical judgment, the examiner will assess you for the sensible and appropriate management plan. Management plan will include your list of investigations along with your treatment plan. So for the list of investigations, always start with a basic one and then move on for the advanced one. And same goes for the treatment plan. Likewise, if you have a case of hepatosplenomegaly, so start with the basic investigations like liver function test and ultrasound abdomen, rather jumping to the CT scan abdomen on the first place. Although you will say CT scan abdomen, but after the ultrasound abdomen. Along with this, same goes for the treatment plan. Start with the general basic treatment plan along with multidisciplinary approach and then give other ideas of advanced treatment. The sixth clinical skill that will be assessed is managing patient's concern. Always remember that this is the only skill, the only core skill which is present and which will be assessed in each and every um, uh, in in uh, in each and every station of communication. It means that you have got 2 clinical communication stations along with consultation station in which you are communicating with the patient. So you need to ask about the patient's concern first. And if you forget to ask about the patient's concern, then you will not be able to manage it. So always remember to keep 1 or more than 1 minute for asking the patient's concern and managing it accordingly. Always remember that you need to listen to the patient's concern carefully and you need to give a relevant, concise, and a very simple language statement to the patient's concern without giving false information to the patient. But for example, if you don't know the exact answer of the patient's concern, then what to do? For example, if you don't know the exact DVLA guidelines regarding some condition and patient has asked you to to talk about or to tell about the driving guidelines or can I drive, doctor? So what do you do in this scenario? You will you can say like that I don't sorry my apologies, I cannot recall the exact DVLA guidelines right now, but what I can do for you is that I'll go to the website and will get you the exact guidelines after this meeting. So before going to home, you will get the exact answer. Likewise, you can also involve consultant or the senior member for any concern you don't know. The last skill is maintaining patient welfare. This is the only skill which will be assessed in each and every station, and it has got very narrow margin of passing. So you need to treat the patient very respectfully and sensitively. Please do not hurt patient comfort, safety, and dignity at any cost. Now, here's a list of different stations along with the skills that are being assessed in each station. For example, in station number 1, you will be having subdivision of communication station and respiratory examination. So in communication station, you will be assessed for skill number C, E, F, and G. In respiratory, you will be assessed for A, B, D, E, and G. For consultation stations in station 2 and 5, all 7 skills will be assessed, while in examination stations, only A, B, D, and E and G will be assessed.